Different vertebrates ventilate their respiratory surfaces differently. So in this video, specifically, we are going to talk about fish. We are going to talk about amphibians. We'll briefly talk about reptiles. And we'll talk about birds. Okay, so remember that ventilation is the movement of the respiratory medium over the respiratory surface. Okay, and so in fish, our respiratory medium is water, and the respiratory surface are the gills. So if we look at a fish, I'm going to draw a very basic fish. See how basic that is? Put a little smiley face on it. Right? The fish has gills, and the gills are encased inside of a covering, which we know is the operculum. So if we sort of look into the fish, right, and take sort of that frontal view, what we'll see is that you have the body of the fish, and then you have that operculum. Okay, so what's going to happen is that this operculum is going to open up. So what you have is the operculum opens up, and when that happens, right, the opercular cavity, notice that our opercular cavity, right, which is our region in here, right, that opercular cavity goes from a small size to a very large size. So that opercular volume, that cavity, the volume increases. So when that happens, that drops the pressure inside of there, and it causes water inside of the buccal cavity to enter that opercular cavity. Now, when the operculum then shuts and returns back to sort of its normal resting size, look, our volume decreases, which increases our pressure. So that's going to force the water out the backside of that operculum, right? And so at the same time this is happening, the mouth, the oral cavity, is sort of doing similar things to bring water in and out of the mouth. But water is going to flow over that respiratory surface in a unidirectional fashion using both a negative pressure, here we have the negative pressure, and a positive pressure, here we have the positive pressure to move it across the back side of the gills, the posterior side of the gills. Okay, so we're using both negative and positive pressure here to move the respiratory medium, water, over the gills in a unidirectional fashion. Now, amphibians have lungs, right? So I'm going to draw their opercular cavity as just sort of a box, right? So no, not the opercular cavity, sorry, the buccal cavity as a box. Okay, and on that box, I'm going to put the nares, okay? And we're going to open sort of this up to the outside world there with our nares opening up. That up a little bit more. There we go. There's our nares, and they're open. Okay, so in amphibians, what's going to happen is that this buccal cavity is then connected to the lungs. Very basic diagrams here. Okay, like so. Now, the first thing that's going to happen is that while these nares are sort of open, the gular floor, or the buccal floor, is going to lower, and when that does, that lowers the pressure inside of the buccal cavity, so air is going to rush in. And then here we're connected to our lungs again. Now, once that happens, what we're going to do is shut those nares, and we're going to go back to the buccal floor raising up. And so when we do so, we increase the pressure by decreasing the volume in here. So the air that is inside here, it can't go through the nares because they're closed, is forced into the lungs. So this uses a positive pressure force to push the air into the lungs. So the way that you can do this is like you puff your cheeks out and pinch your nostrils and then like slam your cheeks shut. You can actually feel that air rush into your respiratory cavity. And that's actually how frogs or amphibians ventilate their lungs. Now, in order to exhale, right, get the air back out, what they're going to do is they'll lower this floor again to decrease pressure and bring it into here, and then they'll open up the nares and push it out, right? So you have a raise lower to get air into the lungs, and then you have a lower raise in order to get air out of the lungs. So two basically up downs of the buccal floor in order to push air into the lungs. Now, reptiles, they have a sort of thoracic cavity where their lungs are going to be housed, and it's anchored to that thoracic wall, right? And so what happens is that the intercostal muscles will expand that thoracic cavity, and because those lungs are sort of anchored to that wall, they will expand with it. And when we expand the volume of the lungs, that decreases the pressure inside of the lungs, and air will enter into the respiratory system. Okay? Birds are a little bit on the unique side, in that birds basically have these things called air sacs. So if you follow the respiratory the respiratory tract, it will eventually hit this air sac, like so. And then we can continue in, and then there'll be another air sac, like so. And then the surface will sort of spin around, and then there can be another air sac, and then it will go out sort of the same way that it came in. All right. Now, what's different inside of the birds is when they expand their thoracic cavity, air will come in and it will hit these anterior air sacs. Okay. And then as they breathe in and out again, they inhale and they exhale. What's going to happen is that the air will move into a different air sac, and then what will happen is that as they do sort of another inhalation exhalation, the air will move into the different air sacs, and it will move across the lungs. Okay? And then it will move out. Now, each sort of bird is a little bit different on how many air sacs that they have and the distribution of the air sacs, but it all sort of works in the same way, is that air will come in through and enter the air sacs and move through the air sacs, and then it will move over the lungs as it progresses through those different air sacs. But notice that even though this is tidal flow in sort of the trachea, the flow across the lungs is unidirectional, right? Just like it was in fishes. Here in our amphibian, we came in, right? And then we went out the same direction. So we had tidal flow through the lungs. Here we have unidirectional flow over top of the lungs. And that'll be important later on when we actually talk about respiration. But that is sort of ventilation in non-mammalian vertebrates.